Our guest today is Dr. Christine Walsh, lead radiologist for the Genesis Center for Breast Health, in this segment sponsored by Genesis Health System. So, Dr. Walsh, October is Breast Cancer Awareness Month. At what age should women begin screening for breast cancer?
So the simple answer to that is that all women need to begin getting their screening mammograms by the age of 40. So if you're 40 years old and you haven't had your mammogram this year, this is the time to do it. There are some people who may need to begin screening before the age of 40, some of our higher risk patients, and that would be something that those patients would be talking to their doctors about. But the simple answer is by age 40.
Okay, so what about screening options? What options are available?
So our main screening test are screening mammograms. So those are x-rays that we take of the breast. We do 3D x-rays to look through breast tissue, and it helps us to get a really good view of the breast, see if there's any changes from old pictures or anything that may catch our attention. Just because we see an abnormality doesn't mean it's definitely a cancer, but it does have us do a little bit more investigating. But mammograms are our #1 screening tool. They're a very fast and pretty simple test to perform. We do some other screening tests, predominantly MRIs, sometimes ultrasounds, but mammograms are really our #1 screening tool.
Gotcha. Okay, who is at high risk for breast cancer?
So there's a lot of things that may put a patient at higher risk, and we consider high risk to be greater than 20% chance over somebody's lifetime. So that could be somebody with a strong family history of breast cancer, possibly a personal history of breast cancer, genetic mutations, people have heard of the BRCA mutation, and then other medical conditions, including dense breast tissue. So when we see patients, we help to calculate that risk to see if they could be at an elevated risk and may need additional screening.
Gotcha. All right. Some good information there. Thank you, Dr. Walsh.
Absolutely.
This was your Genesis Medical Moments. For more information, go to ourquadcities.com and click on the Medical tab.